Hi, my name is Juliana and I'm a student nurse here at Cedar Crest College, and the purpose of this video today is for me to explain how I met all 8 of my Nursing 335 clinical objectives. Starting with objective number 1, this was to utilize previous knowledge of the sciences, liberal arts, information technologies, and nursing to develop skills as a nurse leader. My first example of this would be peer leadership. I was able to be the peer leadership student for Nursing 309 and 313. Through this, I was able to show the students how to do their bed baths and assist them in learning range of motion. And, I taught them a lot about incentive spirometry and body mechanics and things as such in 309. And for 313, I was able to really help them not be scared of the patients and actually talk to them and develop therapeutic communication relationships with them, which I thought, was a mastery of this. And I actually still have some students who come back and ask me for guidance, and it makes me feel like a nurse leader, so I think that means that I kind of mastered it. And my second example of this is therapeutic communication, which I gained in 309 and 313, and I was able to use this in my service leadership hours in the nursing home. I was able to actually gain some therapeutic communication relationships with some of the residents, and also through Meals on Wheels. There's a driver and a visitor, and I was able to go with the visitor and meet the people that they were delivering the meals to and actually develop therapeutic communication relationships with them. And through all the therapeutic communication relationships that I made in this clinical, I utilized silence, therapeutic silence, just therapeutic communication in general, like offering self and just being there for the patient. The objective number 2 was to apply basic principles of management to meet the challenge of an ever-changing healthcare environment. This I met and mastered through a couple of different ways. First, I was able to shadow Kim Hitchings, who is a nurse manager at Lehigh Valley Health Network, as my advanced practice nurse. And she is on a few different boards, and we went to a lot of different meetings. And the first one was nurse residency. And through nurse residency, the nurse managers, who are all they all have their MSN or are master, they're going for their masters. They all get together and they have their own, they call them cohorts, and they are the new incoming nurse residents that are hired, and they go through little cohorts. And in their meetings, they do this thing called Tales, and I think that this is really awesome. They're all able to come in and talk about their triumphs, but also their grievances. And the nurse managers really sit there and they listen and they take into consideration their grievances, and at this point they can manage the nurse residents by either telling them what their next steps should be or handling the situations on their own. And this manages, the nurse residents, but also the other RNs, because they are nurse managers, and kind of, helps to resolve issues in the healthcare field. One of the issues that comes up a lot is nurse-to-patient ratio, which is just, it's a huge thing in nursing in general, not just at Lehigh Valley Health Network. And the nurse managers, through this residency program, are able to kind of hear the grievances and hear the things and kind of take these grievances and, construct them in a constructive way and take them to the higher-ups. Also, another thing would be Future of Nursing. I was able to sit on the Lehigh Valley Health Network Future of Nursing 2020 board meeting actually 2 days ago, and we talked about managing all of the different objectives that are set forth on the Future of Nursing 2020 poster. And this kind of just manages the different goals of nursing at Lehigh Valley Health Network, and all of the nurse managers kind of put in their input and they listen to their RNs, and they kind of manage the goals as in, what is ongoing, what needs a work group, and what can we put to bed. Lastly, through my nurse supervisor, I shadowed Marie Everhart, and I was really able to apply the principles of management to this role because, we went around to every unit. We talked to all of the nurses on each unit, and we asked them if they were okay, what they needed, and we listened to their grievances. And a specific example of this would be, we were on 7C, and we were talking to the nurses, and they were kind of expressing their grievances with chemotherapy, and how there are certain nurses that are certified in chemo and are able to administer it. And that night they only had one experienced nurse, chemo nurse, and a second one who had just come off of orientation. And they didn't feel comfortable because they had 14 patients that night that were supposed to be getting chemo, and they had an incoming patient as well. So Murray was able to listen to this. She wasn't able to, bring in any more chemo nurses that night, but she was able to cap their floor and block off rooms so that they wouldn't get any more chemo patients. And, 14 is a lot. It's a lot when you only have one experienced nurse and one nurse who's coming off of training. So I was really able to apply the basics of management in that sense because she listened to the grievances, she managed the situation by blocking off the rooms, and she really made the nurses feel better. Objective number 3 was to demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. Example number 1 would, my big example of this and how I was able to master this would be my Stop the Bleed campaign that I am moving with over the course of Harrisburg and the college. In this, I was able to formulate I was inspired by a talk at the St. Luke's Trauma Conference, which was my continuing education hours, and I formulated a proposal to Harrisburg, to our state representatives and legislators and senators, to kind of get legislation off on requiring Stop the Bleed packs to be anywhere that there was an AED. And I was able to formulate a proposal, and then when we went to Harrisburg through this class, I was able to present this in front of legislators and senators, and we also presented other topics that were related to nursing and healthcare reform. But this was my big project, and my peers also presented this to the legislators, and I think that I was effectively able to get my point across through communication while also being professional and representing myself and as well as the college, because in Harrisburg they were aware that we were coming as a group, and also nursing as a profession and our willingness to step up and provide patient care, even if it's not necessarily us providing the patient care. We want our patients to survive. I not only met with representatives in Harrisburg, but I also met with the chief of police on campus, Chief Vitalis, and with Dr. Robb, and kind of moving forward with this. Objective number 4, I was critically evaluate and disseminate current research related to principles of leadership and effects on the healthcare system. I was able to master this through a few examples. Example number 1 being nursing shared governance. I actually sat on a meeting with Lehigh Valley Health Network. They practice shared governance. And according to Professor de Blasi's PowerPoint, shared leadership is based on healthcare empowerment principles of transformational leadership, which assumes that a well-educated, professional, dedicated workforce has many leaders. And I actually have the Lehigh Valley Health Network Nursing Shared Governance model here. And they define this model as a framework for the shared governance model at Lehigh Valley Health Network that is based upon concepts inherent within the American Nurse Credentialing Center's Magnet Recognition Program model. They define transformational leadership, which is one of their components, as wherever nursing is practiced, there are structures, processes, and expectations for staff nurses, input, and decisional involvement. Another component of this is also structural empowerment, which states that nurses are involved in shared governance and decision-making structures and processes that establish standards of practice and address opportunities for improvement. It also includes empirical outcomes, and this model really shows that shared governance and transformational leadership and structural empowerment really helps with patient care. It's an essential contribution to patient care, nursing workforce, organizational, and consumer outcomes. I also have another article here that is called Evolution of Structural Empowerment, which is by Joanne Clavel, Tim Porter O'Grady, who is the guru of shared governance, Marla J. Weston, and Joyce A. Varam. And the objective of this study was to describe the maturation of the concept of shared governance to professional governments as a framework for structural empowerment. And the results of this were that the concept and practice of shared governance has matured to a concept of professional governance with the attributes of accountability, professional obligation, collateral relationships, and effective decision making. And this article also hones in on the fact that shared governance and nurses having a say in patient care and being able to rely on evidence-based research as a resource for patient care really helps patient outcomes. It really is important that nurses are involved in their jobs and they have a say in the way the institution is run. Objective number 5 is to function as a competent patient advocate and also to be a change agent. And this I mastered because, well, first and foremost, during my nurse supervisory hours, I was able to see a few RRT's rapid response team. And I was able to, well, I first and foremost saw Marie Everhart, my nurse supervisor. She functioned as a patient advocate because there was one patient who we had an RRT on and he actually decannulated himself, but he was satting at 97% and he never desatted. And she was his advocate because he was adamant that he did not want this cannula, like, to be recannulated. He did not want the trach at all. And she said, well, he's not desatting, so we don't need to replace it. As long as he's not desatting, as long as he keeps above 95%, he is okay, and he can keep the cannula out. And I personally functioned as a patient advocate because another RRT that we were involved in was a neuro patient who was becoming increasingly less responsive, and he was pretty much unresponsive when we got there. And throughout all of the doctors and nurses and everybody talking, nobody except for me noticed that he was on D5W. And anybody that knows anything about D5W knows that neuro patients should not be on D5W. It's not good for them. And it could be why he wasn't responsive. And I actually brought it up to Marie Everhart, and she was like, wow, good catch. And she talked to the doctor, and he was like, yeah, you're right. We're going to take him off of D5W. So that was how I functioned as a patient advocate. And as a change agent, Kim Hitchings and the Future of Nursing Board meeting, I noticed that, they were kind of coming up with constructs on how to move forward and how to change nursing by 2020, and how to just change nursing as a whole. And this is a good example of being an advocate for change. Objective number 6 is to formulate plans for continued personal leadership growth and development as an independent practitioner of nursing and contributing member of society. My first example of how I plan on doing this is joining PSNA, because when PSNA came to talk to us, they said that a lot of young nurses don't sign up for PSNA, and as a whole, we could really have a change on the way things are done in nursing. And my second is the future of my Stop the Bleed campaign, which kind of just goes, I'm planning on going out to schools and planning town hall meetings and stuff, and getting out and being a functioning member of society. Objective number 7 was to recognize the role of the nurse in policy making related to healthcare services at local, state, and global levels. And how I mastered this was going out and talking in Harrisburg to senators and state legislators about my Stop the Bleed PAC and other topics related to nursing and changes in nursing. And also, and joining the PSNA, nurses need to be more involved. This also goes to the American Nurses Association Provision 9.4, which states that nursing profession as a profession must actively participate in solidarity with the global nursing community and healthcare organizations to represent the collective voice of U.S. nurses around the globe. And this just goes to show that we have a duty as nurses in policymaking. And lastly, objective number 8 is to predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice, which I really recognized when, according to the ANA Code of Ethics, we have a duty to patient protection. And when I was at WIC, the woman that I was following around was using names of two other professionals' patient names while gossiping about the patients, which is unacceptable and completely unethical. And obviously, I realized that this is unethical because it violates HIPAA. Thank you for watching my presentation.